adding granularity to your data can have a real impact on viewing the data itself. Can you provide some additional insight into how adding granularity can impact a predictive model?
Oh, yeah, that's, for example, in the ICU, we deliver oxygen to a lot of patients. Too little oxygen can definitely be problematic. But at the same time, there's a lot of data suggesting that too much oxygen can be problematic as well. When clinicians try to analyze or think about how much oxygen a patient's getting, it can be hard. The documentation in the EMR doesn't always reflect what's actually going on at the patient level. And so, this is another example where the high frequency data, gives clinicians the ability to really see and understand what's going on with the patient. And so here's just an example showing cases where, from the EMR standpoint, the patient was on a certain level, but in the room, the patient actually was getting a lot more oxygen. From a model building standpoint, these models are really only as good to a certain degree as the data we provide to them to train them. And so, providing the sort of most accurate representation of what the patient was receiving from an intervention standpoint is going to lead to better performing models. And then also when we apply those models to real patients, feeding them with what the patient is really seeing is also going to allow the model to make more informed and accurate predictions.